Angiography, graphy meaning process of recording, and angio meaning blood vessel. Process of recording the image of blood vessels after injection of contrast material. Or arteriography. Process of recording artery. X-ray visualization of an artery after injection of contrast material. Doppler, named from Johann Christian Doppler, born 1803, passed 1853, an Austrian mathematician and physicist. Diagnostic instrument that sends an ultrasonic beam into the body. Doppler ultrasonography. Ultras beyond sonosography, process of recording image that detects direction, velocity, and turbulence of blood flow, used in workup of stroke patients. And color Doppler ultrasonography, computer-generated color image to show directions of blood flow. Echoencephalography. Echoencephalography.
Echoencephalography.
Encephalo meaning brain, echo, sound wave, and graphy is process of recording. Use of ultrasound in diagnosis of intracranial lesions. An EEG is an electroencephalogram. Record of the electrical activity of the brain. And then we have electroencephalograph, a device used to record the electrical activity of the brain. And there's electroencephalography, the process of recording the electrical activity of the brain. Electromyography. Myo is muscle. A recording of electrical activity in muscle. Myelography. Myel is spinal cord. Myo is muscle. Myel is spinal cord. My is muscle. A radiography of the spinal cord and nerve roots after injection of contrast medium into the subarachnoid space. And nerve conduction study. Nerve meaning nerve. Eon meaning action. Con meaning with or together. Induct, lead, and studies inquiry. Nerve conduction study is a procedure to measure the speed at which an electrical impulse travels along a nerve. Therapeutic procedures. Craniotomy is a surgical removal of part of a skull bone, the bone flap, to expose the brain for surgery. Cranioplasty is the repair of a bone deficit in the skull, often the result of a craniotomy. Cranioplasty uses titanium mesh plates and perhaps bone cement. Microvascular decompression, MVD, is a surgery to treat an artery or vein that is pressing a cranial nerve, for example, the trigeminal nerve. After the craniotomy, the blood vessel is moved off the cranial nerve, followed by a sponge wrapped around the nerve. Deep brain stimulation is the surgical placement of electrodes deep into the specific areas of the brain to deliver electrical stimulations to treat the tremors of Parkinson's disease, essential tremor, or multiple sclerosis. Endoscopic pituitary surgery utilizes an approach through the inside of the nose to remove pituitary tumors. Endovascular coiling blocks the blood flow to an aneurysm. Flow diversion uses stents placed via a catheter to maintain blood flow through a blood vessel where blockage or an aneurysm has occurred. Treatment of many acute ischemic strokes is by thrombolysis, using clot busters such as tissue plasminogen activator, TPA, with 4.5 hours of the stroke, with supportive measures followed by rehabilitation. Within 4.5 hours of the stroke. Treatment treatment for TIA is directed at the underlying cause. Carotid endarterectomy may be necessary if a carotid artery is significantly occluded with plaque. A shunt is used in hydrocephalus to drain the excess CSF from the ventricles to either the peritoneal cavity or an atrium of the heart. And botulinum toxin, Botox injections are used in the treatment of migraines, spasticity, and neuralgias. Treatment of cerebral palsy. A multidisciplinary team of health professionals is required to develop an individualized treatment plan to involve the patient's families, teachers, and caregivers in decision-making and planning. Physical therapy is designed to prevent muscles from becoming weak or rigidly fixed with contractures, to improve motor development and to facilitate independence. Speech therapy and psychotherapy complement physical therapy. A variety of devices and medical aids ranging from muscle braces to motorized wheelchairs help overcome physical limitations. Treatment of gliomas. Treatment is a combination of surgery, radiotherapy, and chemotherapy. The combination is necessary because even if you remove 99% of a tumor, there will be up to 1 billion cells remaining. A more recent therapy, brachytherapy, implants small radioactive pellets directly into the tumor. The radiation is released over time. Botox. Botulinum is a toxin, neurotoxin injected into muscles to prevent the muscles from contracting. Brachytherapy, therapy, medical treatment. Brachy is short. Radiation therapy, in which the source of irradiation is implanted in the tissue to be treated. Cranium, Greek for skull, cranio means skull. The bony container of the brain, excluding the face. Cranioplasty is repair of a bone defect in the skull. And a craniotomy is a surgical removal of part of a skull bone to expose the brain for surgery. Endovascular, relating to the inside of a blood vessel, and a shunt is a bypass or diversion of fluid. Pharmacology of the nervous system. The transmission of impulses from one neuron to another and from a neuron to a cell is achieved by neurotransmitters at synaptic connections. Drugs that affect the nervous system, called psychoactive drugs, target this synaptic mechanism. Psychoactive drugs are able to change mood, behavior, cognition, and anxiety. They can be classified into several families. Stimulants, so caffeine, nicotine, amphetamines, and cocaine enhance the stimulation provided by the sympathetic nervous system. They cause a level of dopamine to rise in the synapses, leading to the pleasurable effects associated with these drugs. The sedatives, ethanol, beverage alcohol, barbiturates, and meprobamate increase the sensitivity to the polysynaptic neurons to quiet the nervous excitement. They also act on the sleep centers to induce sleep. Inhaled anesthetics such as isoflurane acts similarly to, but are more powerful than sedatives. Opiates, morphine, codeine, heroin, methadone, and oxycodone depress nerve transmission in the synapses of sensory pathways of the brain and spinal cord. They also inhibit centers in the brain controlling coughing, breathing, and intestinal motility. Codeine is used in cough medicines. Constipation is a side effect of all these drugs. Opiates are addictive because they produce tolerance and physical dependence. Opiate antagonists such as naloxone and naltrexone prevent opiates from acting in the synapses. They can be used in drug overdoses and to help a person recovering from heroin addiction stay drug-free. Tranquilizers such as chlorpromazine, haloperidol, and the benzodiazepines like Librium, Valium, Xanax act like sedatives but without their sleep-inducing effect. Antidepressants all increase the amount of serotonin at the synapses where it is a neurotransmitter. Antidepressants are used to treat neuropathic pain migraines. Amitriptyline, Sterline, Zoloft, and fluoxetine Prozac are examples. Psychedelics distort sensory perceptions, particularly sight and sound. They can be natural plant products such as mescaline, psilocybin, and dimethyltryptamine. They also can be synthetic, such as lysergic acid, diethylamide, LSD, methylene, deoxymethamphetamine, MDMA, or ecstasy, and phenylcyclidine, PCP, or angel dust. They increase the amount of serotonin in the synaptic junctions, and some have an additional amphetamine stimulation. Marijuana has the active ingredient tetrahydrocannabinol, THC. It produces the drowsiness of sedatives like alcohol, the dulling of pain like opiates, and in high doses of perception distortions of the psychedelics. Unlike the case with opiates or sedatives, tolerance does not occur. Medications have crossover to other conditions. Anticonvulsants used to treat epilepsy may be used to treat neuropathic pain. Beta blockers used to treat high blood pressure, hypertension, also treat migraines. Medications to treat epilepsy are based on the type of seizure. If one medication is ineffective, the other medication can be added. Carbamazepine, Tegretol is often a first choice. Other medications include pregabalin, Lyrica, valproic acid, Depakote, Brevacetym, Breviact, and lacosamide, Vimpat. Oh gosh. Cuckoo, come here. Come here, Shaky. Come here. Come here. Come here. Come here, bud. Come here, bud. Come here. Come here. Come on, lay down. Let's see. Spasticity is treated with skeletal muscle relaxants, baclofen, benzodiazepines such as diazepam, and botulinum toxins. Migraines can be treated for acute episodes or preventatively. Acute episodes medications range from NSAIDs, caffeine, beta blockers, antidepressants, and triptans such as frovatriptan, like Frova, rizatriptan as Maxol, and sumatriptan as Imitrex. Preventative medications such as botulinum toxins, Iranimab, Imivig. That's what it says. See? Iranimab, Aimovig, Galcanazumab, Emgality, and Ubrogepant, Ubrevlev. I'm proven effective. Oh my god. Okay. Antibiotics are used to treat acute bacterial infections that cause encephalitis and meningitis. A culture of the CSF obtained via lumbar puncture determines the choice of antibiotic by identifying the type of bacteria present. There is no treatment for viral meningitis. Viral meningitis is typically mild and the duration of illness is short. Medications to treat multiple sclerosis are categorized as those that slow the progression of disease symptoms such as bladder problems, fatigue, depression, and pain. Medical marijuana may help with spasticity and bladder problems. Addiction, habitual, dict meaning consent, surrender. Habitual, pathologic, and physiologic dependence on the substance or practice. Addictive, pertaining to or causing addiction. Antagonism is a situation of opposing. Antagonists, an opposing structure, agent, disease, or process. Agon, or agon, agon, or whatever, means contest against. Antiepileptic, meaning a pharmacological agent capable of preventing or arresting epilepsy. Psychedelic, psych mind, del is visible. Agent that intensifies sensory perception. Psychoactive, able to alter mood, behavior, and or cognition. Sedative, sedate is calm. Agents that calms nervous excitement, and sedation is a state of being calm. Stimulant, ant is forming, stimulus, excite, and strengthen. Agent that excites or strengthens functional activity. Stimulate, arousal to increased functional activity and stimulation. Tolerance, the tolerance to endure. The capacity to become accustomed to a stimulus or drug. Tranquilizer, agent that calms without sedating or depressing. Okay, pain. Pain persisting longer than 3 months is said to be chronic. It is said it can be caused by cancer, arthritis, fibromyalgia, low back and neck problems, headache, or injuries that have not been healed. Normal activities can be restricted or be impossible. In 2016, the cost of chronic pain was an estimated $560 billion due to medical costs, loss of work productivity, and disability programs. In modern healthcare, chronic pain management has become essential and often uses a multidisciplinary approach. Pain management is now a board-certified subspecialty for anesthesiologists. Medications are the cornerstone of pain management, and the following can be used depending on the severity of the pain. Mild pain, analgesics such as acetaminophen and non-steroidal anti-inflammatory drugs, NSAIDs, NSAIDs, such as ibuprofen, are used. A study published in 2017 by 28,947 Danish patients showed that the patient taking NSAIDs had a 31% increased risk of having a cardiac arrest. Moderate pain, opiate medications in combination with acetaminophen or NSAIDs are used. Some opiates used in combination medications are codeine, hydrocodone, and oxycodone. Examples are hydrocodone and acetaminophen, which is Vicodin, and then oxycodone, acetaminophen, which is Percocet, and oxycodone aspirin, which is Percodan. These opiate medications are addictive and are frequently abused and sold on the street. Severe pain. Higher doses of opiates are used, not often as combination products. These include morphine, fentanyl, and oxy and hydromorphine, or morphone. The opiates can be taken orally or by patch, sublingually, by intravenous infusion, or by continuous delivery systems. These oral opiates are also addictive and are sold on the streets. Buprenorphine is an opiate that has recently been recommended for treatment in chronic pain. It provides analgesia with less risk for abuse and addiction. It is a controlled substance. And there are strict federal regulations on the qualifications of physicians allowed to prescribe it. Central sensitization pain is a new concept describing how neurons in the spinal cord sending messages to the brain become excitable. They exaggerate the pain response in tissues they supply. The input can be somatic from skeletal muscles, as in fibromyalgia, or visceral, as in irritable bowel syndrome. Interventional pain management, particularly for pain originating in the spine, spinal nerves, is being increasingly used. Examples are epidural or facet nerve blocks Anesthetic or anti-inflammatory agents are injected into an area surrounding the pain-generating nerve. Radiofrequency RF nerve ablation. A probe heats the area around a pain-generating spinal nerve and temporarily deactivates it. Spinal infusion pump. Pain medications such as morphine are delivered through an indwelling catheter into the intrathecal CSF surrounding the spine cord. A pump delivery device is inserted under the skin of the abdomen. Phantom limb pain occurs following the amputation of a limb or part of a limb. Any stimulation of the remaining intact portion of the sensory pathway coming originally from the limb is interpreted by the brain as coming from the original limb. The pain can be severe and debilitating, or just an insatiable urge to scratch and itch. Wow, that sucks. Referred pain occurs when pain in the viscera is felt in the skin or other superficial sites. An example is the pain of a heart attack felt along the front of the left shoulder and down the other side. Oops. An example of pain of a heart attack felt along the front of the left shoulder and down the underside of the left arm. This is because spinal cord segments T1 to T5 receive sensory input from the heart, as well as from the skin and shoulder and arm. This input is transmitted to the brain. The brain can't distinguish the true source of the pain. It assumes it is coming from the skin, which has more pain receptors than the heart and is injured more often. What am I looking at right here? Referred pain. What? That's crazy. Look at this kidney pain. Kidney? All kidney? Oh my goodness. That's amazing. Okay, ablation is removal of tissue to destroy its function. Analgesia, a state in which pain is reduced. Analgesic, a substance that produces analgesia. Anesthesia is complete loss of sensation. Anesthesiologist is medical specialist in anesthesia. Anesthesiology is a medical specialty in anesthesia. Anesthetic, an agent that causes an absence of feeling or sensation. Facet is a small area, in this case around a pain-generating nerve. Intrathecal, within the subarachnoid or subdural space. Morphine, Latin for God dreams, a derivative of opium used as an analgesic or sedative, and opiate, Latin for bringing sleep, a drug delivered from opium.